In front of you is the left lobe of the liver in longitudinal section of a 60 years old female with a history of severe hypochondria, right hypochondrium pain, with the history of cholecystectomy a few years back. What is seen is there are two echogenic focal lesions with halo around. This black area is the halo, and this is the second one, and they are seen in the segment 2 of the liver, and or otherwise you can also say that it's one of them is in the lateral segment of the left lobe of the liver, the other is at the medial segment of the left lobe of the liver. This is the aorta, this is pyramidentelic artery arising from it, and there is no evidence of any lymph node enlargement in this region. Now you see, this is the pathology. Now this is a focal lesion measuring, largest one is this one, measuring approximately 2.5 into 2.7 with an internal anechoic area, and the other one measures approximately 2.5 into 1.5, and you can note that it's echogenic in the center with a halo around it. Here it's also echogenic with a halo around, and however an internal anechoic area suggestive of internal degeneration, necrosis is seen. There is history of cholecystectomy a few years back, and you will see such lesions in all segments of the liver. See, this is another one. This is another one in the right lobe of the liver. Let me show you one other thing that's of importance. This is the caudate lobe of the liver, and the caudate lobe is spared. This is the caudate lobe, ligamentum venosum. So the caudate lobe is spared. There is no adjacent adenopathy. The liver is seen below costal margin, is alive, and patient is tender in this region with multiple echogenic areas with a halo around, seen in all segments of the liver. You can see they are everywhere. So this is a case of, though there is no evidence of intrahepatic bile duct ectasia, portal vein is normal in caliber, is not dilated, and common bile duct is normal. This is the portal vein, this is the common bile duct, this is the hepatic artery in transverse section. These are the two focal lesions. And this is a case of diffuse metastatic liver disease. The primary, I don't know why was the gall bladder operated upon. Maybe the metastatic lesions, 1, 2, 3, 4, 5. So multiple lesions in all segments. Kidney is normal. Here you will see again. This is another focal lesion which is centrally cystic, anechoic, maybe area of central degeneration or necrosis. This is the other one in the posterior segment of the right lobe, measuring approximately 3.1, 2.8, and this is the other focal lesion measuring 2.9 into 2.6 millimeters. So this is a case of diffuse metastatic liver disease with no other finding, as I have gone through this patient thoroughly, and cause of pain are these multiple metastatic lesions in all segments of the liver. This is focal vein. And This is also a focal lesion. This is a focal lesion. This is a focal lesion, which is consistent with the metastatic lesion. Thank you very much.